Hello, it's Dr. Rhonda Johnson, and today is Thursday, September 7th, 2023. Do you read the newspapers still? Well, I do. And today I'm going to be discussing an article that the Boston Globe ran on August 17th, 2023, titled, "With COVID on the Rise Again, Here's a Guide to Staying Safe in 2023. Now, I actually like the Boston Globe's coverage of the COVID-19 pandemic, and over these past 4 years or so, I've followed the newspaper coverage. So one of the topics in this article was, do you need a mask? And I realize masking is a hot button topic for this country, at least. And so they interviewed several infectious disease experts, and their answers probably are going to be disagreed by many who view my videos. But this is what these experts said. Well, should you wear a mask depends on your own general health, the health that you around people that you live with, how crowded your surroundings are, and the amount of cases in your region. One expert said, if you're in good health, you don't live with someone who has a weakened immune system, then masking in most places that aren't super crowded probably isn't needed, especially if local wastewater data is showing relatively low levels of COVID-19 infections. Now, another expert was quoted as saying, don't think of the mask as a tool of the past. Think of it as a tool for now, much like an umbrella. Again, we're on our own in this pandemic, so those of you that consistently wear masks, you should probably continue doing what you've been doing. And maybe this article might motivate a few people who don't wear masks to wear them. Now, another topic in this article was, should you quarantine if someone in your household tests positive for COVID? Now, this information I thought was really helpful. The CDC, they recommend that people use the CDC's isolation and exposure calculator on their website. It's a tool that can walk you through the steps that you can take if you or someone in your home is exposed or infected. The article states that the CDC does not advise people who have been exposed to an infected person to quarantine. Instead, the CDC recommends that you wear a high-quality mask inside your home or when you're around others or when you're indoors in public places, and that you take a COVID test at 5 full days after being exposed to someone who is infected. And according to the CDC, you can still develop COVID up to 10 days after you have been exposed, so you should continue masking through the 10th day. So get those masks back out, because there's a lot of people who are going to be exposed to someone infected with COVID. Another topic was the expiration dates on the at-home COVID tests, and are these at-home COVID tests still reliable? So the article advised to don't toss out your tests without checking the government site for updated expiration dates. Now, many of the FDA authorized at-home COVID tests are still effective for up to a year past the date stamped on the carton. So you may still use them even if the date says that they're expired. Check on the FDA website. Lastly, the article noted that the percentage of adults reporting long COVID has declined in the past year, according to a report in the August 11th, 2023 issue of the CDC's Morbidity and Mortality Weekly Report. According to the CDC, the percentage of adults reporting long COVID dropped from 7.5% in June 2022 to 6% in June 2023. So that's my message today. Again, I know everyone's not going to agree with the opinions expressed by some of these experts in the article, and it's okay. So be safe, take care, and until next time, be well.